Hi, good morning, OCF family. Today I'd like to talk with you about ACL injuries. The ACL is the anterior cruciate ligament. There are many ligaments which help stabilize the knee. Two of the crucial ones are the anterior and the posterior cruciate ligament. So in this knee model, you have the anterior cruciate ligament, which comes from in this right knee model, which I'm going to move the kneecap out of the way so we can see. The ACL comes from the lateral side of the knee, the inner aspect of that, and runs to the mid portion of the tibia. So it comes off the femur and it comes this way. The PCL, which you can actually see better through the back, comes from the other side of the femur and goes to the back of the knee. The ACL, which we're going to focus on today, helps to limit anterior, so from the side view, front translation of the tibia, and also resists rotation as well. And so it's really important as we move and as we twist to help stabilize the knee. One of the things we don't like to hear, especially young athletes, but athletes of all ages come in and say is that they felt like their knee buckled on them. This doesn't have to occur with a forceful contact type injury. In fact, majority of ACL injuries are what we call non-contact injuries, where an athlete was trying to change direction or landing from a jump while trying to twist, and oftentimes they feel a pop in the knee or sometimes hear a pop, and they have immediate onset of pain and oftentimes drop to the floor. Within minutes to hours, there is oftentimes swelling associated with that because the ACL has vascularity to it, and those vessels rupture when it's torn. In addition to that, it's oftentimes accompanied by other knee injuries, such as a meniscus tear, or the cartilage, the smooth part of the joint, gets injured because the knee moves too much, and it actually causes a bone bruise, another cause for swelling and pain. When an athlete feels as if they've had an instability episode, like their knee buckled on them, it is really important to have timely evaluation. Get in to see your physician and your orthopedic surgeon as quickly as possible. One of the reasons for that is we can help recommend things to minimize the swelling and to restore range of motion of the knee as best as we can. And we can order timely studies if needed, such as an MRI if our exam is really concerning. Now, rest assured, there are ways to address ACL injuries. If it is a significant, where the vast majority of the ACL is torn, then we oftentimes have to have a conversation about what a surgical option might be. It doesn't mean that everyone needs surgery. There are some patients that are able to cope or manage with a torn ACL depending on their activities, but with very involved twisting, turning, jumping, sporting activities, and this could include basketball, soccer, skiing, racket sports, which require twisting and turning quickly. Patients oftentimes cannot tolerate it because even when they regain strength, they try to go back, the knee just doesn't have the stabilizer which it needs with the ACL. In those situations, we'll do an ACL, anterior cruciate ligament reconstruction. We'll either use tendon tissue from the patient, which is what I do the vast majority of cases, especially in younger athletes, or in some situations we'll use donor tissue, what's called cadaveric or allograft donor tendon, to recreate a new ACL. This is done through minimally invasive surgery, and it does require patience and a whole team approach, including our physical therapists, to help with the recovery after, and we're ultimately able to get the athlete back to play. Now, I don't boast about how quickly I can get an athlete back, because we actually know from the literature if patients go back too quickly or are not properly rehabilitated, the risk of re-rupture is much higher. So, I carefully guide the patient through the recovery process, and there are certain criteria to progress with rehab, and ultimately there are certain tests which we, use from literature studies which have really shown some tests which can predict which patients are really much more able and ready to return to sport. So the risk of having a re-injury is much lower. So, the main thing is, if you feel like your knee is unstable, you had a major shifting sensation in the knee, a lot of pain and swelling, get it checked out, and we're here to help you.